So the mission of our program is to train independent health services leaders and researchers and to prepare them to provide leadership in the field. Our students gain analytical and practical knowledge and skills for conducting research aimed at improving health of diverse communities. We teach our students approaches, methods, and principles for conducting research with practical applications for improving the public's health and the effectiveness of healthcare and population health services. We also teach our students to understand the means by which social inequities and racism generated by power and privilege undermine health. So now what we're looking at is just some demographic information, just for transparency. An essential part of our identity at the University of Washington is our commitment to equity, diversity, and inclusion, and our student body reflects that. They come from a wide variety of backgrounds, academically, personally, and professionally. And this PhD program deliberately keeps our incoming cohort sizes very small. So in a typical year, our class size could be about, it says here, 5 to 8 students. In recent years, it's more like 4 to 7, give or take. And this small class size means that our students receive a more personal experience with high quality mentorship from faculty. It also gives them access to generous funding support. And about 3/4 of our students come from outside the state of Washington in recent years. And international students have comprised about 14% of our student body. This is for a couple of reasons. One, the reason the majority of them would be domestic citizens and U.S. permanent residents would be the part of it's the content focus of the program. So this program is more focused on training experts in domestic issues of population health and the healthcare system within the United States. So there's very little comparative health systems or global health content. And UW does have an excellent global health PhD program, but it's just a separate one from this one, and that lives in the global health department. And then the other reason is that our funding sources are limited to US citizens and permanent residents. But we will get more into funding later on. And then our program has historically been majority women. So what we're looking at are, this is data from applications of folks who've been accepted to the program and accepted their offers, so incoming cohorts. So of incoming cohorts, how they self-identified on their applications, about 3/4 identified as women, a little less than a quarter identified as men, and then about 4% either did not share any gender information or gave us non-binary pronouns. And then students of color have comprised about 50% of our student body in recent years. And then we have a breakdown of how that shakes out below. And overall, I think that these demographics are fairly consistent with what we see in the field of public health. And none of these factors are considered when we're making these decisions. This is, again, just for transparency. Because a lot of folks ask, what do these classes look like? What type of group am I joining? So we like to share this demographic information for that purpose. So quick program overview. Our format is full-time on campus. There's no online learning component to this degree. All courses are going to be in person. And average time to graduation is about 4.5 years. So we're very committed to getting students in, providing them with rigorous, high-quality training, and then getting them back out the door. We know that people don't want to languish in their PhD program forever, so we do try to keep that graduation turnaround pretty tight. And 100 credits are required to earn the doctoral degree. And the University of Washington is on a quarter system rather than a semester system. So these are fulfilled through 12 to 13 required courses, 30 dissertation credits, as well as at least 5 courses in your area of emphasis. And we now offer 6 areas of emphasis in this program. So they are evaluative sciences and statistics, health behavior and social determinants of health, health economics, implementation science, occupational health, and the newest one, which is training in equity and structural solutions and addictions. We don't have time to run through each of these areas of emphasis, but I do have a link here, again, that you'll have when I send out the slides to learn more about all of these areas of emphasis. It's not required that you know for certain which one you plan to pursue when you apply. You actually don't officially declare the area of emphasis until you pass the preliminary exam in year 1, and then you officially declare it and start taking area of emphasis courses in year 2. But at the time that you apply to the program, it's definitely appropriate to have a sense of 1 or 2 areas that you feel most drawn to pursue, and to state that explicitly in your written materials, in your statement of purpose. But yeah, it's not, you don't have to know for certain. You're not glued to it at the time that you enter the program. Okay, so this is I feel like it's the wordiest slide. And again, do not worry about scribbling this all down, because you will have access to this later. But what this is an at-a-glance example of what 4 years in the program would look like. I mentioned that we are on a quarter system. So from left to right, we see quarters autumn, winter, spring, and then top to bottom, years 1, 2, 3, and 4. So the first feature that I want to highlight is the HServe 512, 513, and 514 that we see here in year 1. So in many ways, this sequence is the heart of the program. This provides the knowledge and content that we feel that all of our students need to have in order to become experts in the discipline of health services research. This covers everything from health systems and policy, health policy research, to the social determinants of health and health disparities. It's an excellent series. The faculty who teach it are very passionate about it. They put a lot of love and energy into making it the best that it can be. And our students consistently tell us that these courses are well taught and vital to this program. Also, let's see, in the first year, you can expect biostats 511, 512, 513, and epi 512 and 13. And these courses are part of the foundational knowledge that you need for this degree. And some of you may have already taken coursework that's equivalent to some of these foundational courses. And if that's the case, then once you've been admitted, you can consult with our program director about getting course waivers. And then in some cases, students will start with the advanced method sequence in year 1. In our advanced method sequence, that in this example, we currently see in year 2, that's the HServe 523, 524, and 525. So yeah, if you do start with that advanced method sequence, that would put you in a position to complete the program a little more swiftly than somebody who did not. We can also see that there is a seminar in year 1. You'll have guest lecture, practice literature review and critiques, get some acculturation in the field of health services. You have your health econ class and our required course in racism and public health. And then I want to highlight some of the benchmarks of the program. So I have those in uppercase, bold font in years 1, 2, 3, and 4. So the preliminary exam, the written general exam, the oral general exam, and the dissertation defense. So let's dive into the prelim. So here, like I said, we refer to it as the prelim. Most public health programs have some sort of qualifying exam like this. They might call it the qualifying exam if they don't call it the prelim, but for us, what it is, all first-year students take the prelim at the end of their first spring. And this tests your mastery of all of the foundational content that you've learned in year 1. So passing this exam certifies that you've attained sufficient mastery in these areas and that you can move forward and go on and begin to complete your independent dissertation research. And to share a bit about our philosophy behind the prelim, I know that some programs will admit more students up front, more than they feel will really succeed in the program, and then they'll use the prelim to fail out students. And that is not what we're trying to do. That's not our model. What we do is we have a very rigorous admissions review up front. That way we hope to make sure that with the students that we do admit, that we're really confident in their ability to succeed and thrive, and that we're committed to working with them for success in the program. Now, it is technically possible to fail the prelim and fail out of the program, but that has happened extremely rarely in our program's history. It's not how we use the exam. We do need to see that you pass the exam, but we'll work with you to get there. So the way it works, there are 5 components, and you need to pass all 5 to move forward. There are 3 written essays, 1 for each of the core sequences, the 5, 12, 13, and 14. There's a quantitative method section that will have you exploring a novel data set to analyze and answer questions that will draw upon your training in biostats and epi. And there's also a literature review and critique section. And like I said, in order to pass the exam, you need to pass all 5 sections. But it's not unusual for students to need to revise sections in order to obtain that passing grade. And those revisions would typically happen in the summer after year 1. Okay, so moving on from that, in year 2, you will, like I said, formally declare your area of emphasis and begin to take those courses. So we see those as area of emphasis elective. And those other benchmarks that I mentioned, first we have the written general exam. This tests you on your dissertation proposal as well as on the area of emphasis content that you've learned so far. The oral general is the defense of the solution proposal. So here you've probably been doing some research. You may have some preliminary results to share at that point. And then the dissertation defense in spring of year 4 is the defense of the dissertation itself right before you graduate. And for us, the dissertation product is 3 papers on novel research that you've conducted with your dissertation committee, and they should be of publishable quality. And we require that our students have submitted at least 2 to 3 dissertation papers for publication by the time that they graduate. We don't require that they've been accepted for publication. We know that even if you do your very best work and it's a wonderful paper, you can't control whether journals will ultimately make the decision to publish it, but we do want them to have been submitted. That being said, this certainly contributes to our excellent track record of student publication. And we also have an expectation that students are involved in research in some capacity from their first quarter in the program, and that they're maintaining this research engagement throughout the program. So our students are doing a lot of interesting work. They're publishing a lot. You can actually see publications for many students on our website. And we also have stories about the publications that students are involved in on our news pages, which that will be linked at the end of the presentation. But sort of zooming out, we can see that the coursework is very front-loaded in those first 2 years of the program. So after those first 2 years, many students are a lot more free because they don't have to come to campus as much for classes, and they can really just focus on their research for the dissertation. They have a lot more flexibility. A lot of students still do come to campus, but they do not have to. So research excellence is the pride of our program. And University of Washington is one of the nation's leading research institutions. We are an R1 institution, so we're ranked #1 among public institutions in the nation in receipt of federal research funding. So this means that there are tons of research going on, a lot of dollars coming in to support that work, and our faculty are using those funds to support and mentor graduate students. We have many opportunities for multidisciplinary research, both on campus and with our numerous partner organizations and agencies. So we can see some of those listed here. There are too many to list them all, but these are some of our key players. We have the nationally known Fred Hutchinson Cancer Research Center. We work very closely with them, as well as the VA Puget Sound Healthcare System, the Kaiser Permanente Washington Health Research Institute, Seattle Children's Hospital. At UW, we have a fantastic Latino Center for Health, as well as we have the Foundation for Healthcare Quality, a terrific local public health department for public health, Seattle King County, as well as Tacoma Pierce County Health Department, Washington State Department of Health, as well as the Department of Labor and Industries and Social and Health Services, and the Washington State Healthcare Authority, in addition to numerous health plans, insurers, hospitals, and clinics. Okay, so at this point, I'm going to move into talking about faculty advising and mentorship. So before entering the program, all incoming students are assigned a faculty advisor for the first year. And we do this after we know who has been offered and accepted their offers to join us. So we don't do this, you don't have to do this at the time that you're applying. This happens after you apply and you're accepted and you accept your offer. So we do this based on your research interests and their research interests, your preferences and their preferences and availability. So it's a good idea to list faculty that you're interested in working with in your essays, in your statement of purpose. And it's also a good idea to list more than one person because, you don't know who's available or who's about to go on maternity leave or who might be retiring or taking a sabbatical. So yeah, it's a great idea to list more than one person that you are interested in. And the first year advisor will help you with course selection, networking with faculty researchers, developing research plans, career development, and more. And some of the tools that you can use to find faculty that you will list on your application. So we have here, it says AOE leads. Those are the leaders of our areas of emphasis. As you read about each area of emphasis, on that page, we list which faculty is the lead of that area. We also have a webpage of all department faculty list, and you can filter specifically to this program. You can search by name. What most people really enjoy is that you can search by research interest. So you don't have to scroll a name and then read their bio to see if your research interest is listed there. You can actually search by your own interest, which is nice. And then the School of Public Health also has a similar tool. Just know that it will bring up folks from outside this department. So it's not impossible for you to have mentorship and advisors from outside this department, but we're definitely set up better to provide you advising if your official advisor is someone from this department. So keep that in mind. But we do have interdisciplinary work going on with other departments in the University of Washington. So yeah, not unheard of to also work with faculty outside. And you can certainly reach out to faculty before applying to the program to learn about research opportunities going on, learn about, your fit in the program. But you do not need to reach out to faculty to have them, asking them to provide you funding before you even apply. If you do that, they might forward your email to me because they might assume that you haven't, learned about how we do admissions in the program. So yeah, you don't have to have somebody commit to you before you apply to the program. All right, so as the students' interests evolve, they'll choose a mentor with expertise in their dissertation topic to become their dissertation chair. So this may or may not be their first year faculty advisor. It might be somebody else if you found somebody that's, that you gel with better, that, their research interests are just closer to yours. And this dissertation chair will help you with developing a feasible research topic and agenda, forming a dissertation committee, dissertation curriculum counseling, searching for appropriate funding, and reviewing your individual development plan. Okay, so as a graduate of this program, our alumni's career outlook is very strong. It's one of the things we're most proud of. So this program was founded in the year 2000. It says here over 90 graduates. I think it might be 100 now. But yeah, we have a very strong alumni network. And they work as independent health services researchers in universities, research and policymaking organizations, the healthcare industry, and government agencies. In a recent alumni survey, 100% of folks who responded were employed in research, 98% were employed in health services or related fields. And of those who were in faculty positions, over 40% let us know that they were tenured. And we can see a pie chart on the top right that just gives you a breakdown of different fields that folks are in. So 57% were faculty researchers, 37% were researchers, and 6% were completing a postdoc. And then the map on the bottom right, this is just shows us just where some folks have landed across the United States. So one thing that we can do as folks are getting closer to graduation, if you're say like, hey, I'm thinking about moving to Boston, is there anybody in Boston? We can, see who's in Boston, connect you with them, see if they can either, just give you casual, like a casual networking meeting or more, like maybe they can give you advice about the job search there, help you get a foot in the door. Yeah, we're happy to make those connections, and it's a nice network to be a part of. We also see our alumni often at we travel for conferences in this program a lot. I'll go into more about that in a bit, but we'll have PhD mixers where students and alumni can connect, and yeah, it's great to, a lot of folks are happy to offer advice or share their experiences with current students. And we have pages on our website that just share alumni stories, like what they're doing in public health now. And then we share information about with what careers and what fields alumni are working in. If you want to visit those pages, I think it can be a helpful tool to find inspiration as you're learning more about this program. Okay, so now we have some sample career titles. I won't read out the entire slide, but just want to highlight the theme of leadership that we see here. So we have professor and chair, core investigator, director, epidemiologist, global wellness manager, research scientist, senior consultant, data analyst. So it's very satisfying to see our alumni go on and take on prestigious positions in their field, because that's why we're all here, to move forward in our careers, right? Okay, so a little bit about career services. So the School of Public Health at the University of Washington actually has a career services department. They offer one-on-one career advising, job search resources, panels, networking tips, resume guides, practice interviews, and they post jobs. There are also a bunch of student organizations and public health networks that our students are a part of. You can look at those on the website too. There's a University of Washington Career and Internship Center. They have career coaches and additional resources. And this program, I mentioned the networking with alumni. We also have a private LinkedIn group for students and alumni. We have job postings, and then our faculty. I mentioned that we have small class sizes, which allows our students a lot of attention from our faculty, and part of that is career advising. All right, so let's talk about tuition and fees. So this is an approximation of what tuition would look like. And University of Washington is a public state institution, so it does have a two-tiered tuition rate for residents and non-residents. That said, most funding mechanisms that exist for doctoral students would automatically knock you into that lower tuition category, and then any tuition support would be applied to that rate. What I did is we have tuition and fees, and then in bold here we have tuition and fees for 1 year, and then I multiplied it by 4 to give us the approximation. But just know that these are tuition rates are always subject to change, and this is based off of the 23-24 academic year. And then here we have a breakdown of what those fees are. So we have the technology fee, the services and activities fee, IMA bond fee, that's the intramural activities center, the rec center, which is actually really nice and new. Facilities renovation fee. The UPass gets you on the light rail and the bus. So that's your transit. And then the total. And for funding, our goal is for each student to have sufficient financial aid to support their scholarship. And we'll work with each student to put together an aid or work package that meets their particular needs. So it's different for everybody. But this would include our training programs, which I just realized one is missing from here. But we have the RQ NRSA T32 Health Services Research Training Program, the Occupational Health Services Research Training Program, the new TESSA T32 Training Grant, and then we have the Biobehavioral Cancer Research Training Program, which is not linked here. Sorry about that. I'll add that to the slide for next month. But I'll add it to the slide before I send it out. But yeah, those are our no service training grants. So the way they work for the first couple years of the program, it's usually for the first couple years of the program, followed by the student working as an assistantship in those later years, 3 and 4. But the way no service training grants work, basically being a student and doing a good job in your coursework and everything that's involved there, that's what your job is. So you're not getting funding for any additional work hours, it's just for being a student with those training programs. And yeah, they provide you with tuition support, health insurance, and then they may also have additional funds for research related costs like travel to conferences. And we also do have additional funds in the department for student travel to conferences. You know, I mentioned a bunch of times already that we're committed to research excellence. So we want to make sure that our students have every opportunity to present their work and get recognition for it and to network with other researchers in the field. So yeah, going to academic conferences and sharing your work is a big priority for us, and we want to help make that happen for you. All right, so I mentioned those assistantships. So those are often teaching assistantships, research assistantships, or staff assistantships. And the way that those are funded, it depends on the department, on the position. But the way they work is they are jobs, so you do have to apply to them once you're admitted to the program. But you can apply to them in this department. You can also apply to them in the UW School of Public Health outside of our department. You can also apply to them outside of the School of Public Health. And they're a great way to help fund, help fund your education. We also have a variety of scholarships for other factors like academic merit, financial need, ability to contribute to the diversity of the incoming class. It's very important for us to diversify the public health workforce and for our students to reflect the communities that we serve in our research. So very committed to attracting and enrolling and retaining a diverse student body. And then we also have employment outside of UW. So local health orgs and businesses also employ doctoral students. And I mentioned before that our primary sources of funding are typically limited to US citizens and permanent residents. So we cannot guarantee financial support for international students. International students who have come through the program are typically funded on assistantships, or they might bring funding with them, or find scholarships outside of this department. Okay, so admissions timeline. September 1 is when the application opens. So do not start your application on the webpage until September 1st. That will just give us time to make any tweaks in the back end that we need to make, and to make sure that your application is grouped in with autumn 2025 entry. Make sure you're not accidentally linked in with the wrong year. So wait till September 1, and then you can start your application. And December 10th is the application deadline. Now, I'll go into this in a little bit, but I recommend getting your application in early for various reasons. I guess I'll go into that in a little bit, but it's great to not wait until that deadline, just because some factors can be out of your control and slow things down, like maybe technology not working, or waiting on your letters of recommendation writers to submit their letters, stuff like that. So this is the deadline, but why wait? Get that stuff in early. And then by mid-February, our admissions committee will convey their decisions to all applicants. And then April 15th is the applicant decision deadline. So if you receive an offer, that's when we ask you to tell us if you plan to accept that offer and join us in the fall. And then late September, classes begin. So the University of Washington Graduate School does have some minimum admission requirements. So they require a bachelor's degree from an accredited college or university in the United States, or its equivalent from an international institution. And they require a minimum of a 3.0 GPA on a 4-point scale for the last 60 graded semester credits or the last 90 graded quarter credits. And this program sets a minimum bar that we want to see a passion and aptitude for research in public health and health services. These are our minimum admission requirements. Next, we're going to talk about some factors of what successful applicants have tended to show. So none of these are minimum cutoffs, and I want to emphasize that. So we're especially looking at these GPA metrics. These are not minimum cutoffs, but when we look at the numbers, when we look at the applications of folks who have received offers in recent years, these are some averages, these are some things that they've had in common. So high academic standing is important to us. So I mentioned before that we have a rigorous program. And so, having a high academic standing is important to us because we want to know that you will succeed in the program. So having a graduate GPA of 3.7 or higher and an undergraduate GPA of 3.5 or higher is what recent accepted applicants have tended to show. Also having a relevant academic background, so bachelor, master, or professional degree in a field related to health services and public health. So, for example, epidemiology, health services, biostatistics, health economics, or other social behavioral sciences. Again, not a minimum cutoff. If your major or your master's degree is in something else, just let us know in your written materials why it's related, how it helped prepare you for this program. And then we have research experience and publications. It is not required that you have published to get into this program, but we do love to see it if you have. We also look for strong service orientation. So I mentioned passion and aptitude for helping the public health and helping all communities. It's very important to us. Unique and diverse background and experiences, and faculty interviews when possible. So when you can, reach out to those faculty and ask them questions about the program, about any research opportunities. about their recent research. Those are a good idea. I wouldn't say just email a faculty member without looking into them at all and saying like, hi, Dr. Smith, tell me about yourself. Like that probably won't leave them with a good vibe. But, you know, letting them know like, oh, I saw that you like to research suicide prevention. Can you tell me about recent projects and anything upcoming that I might get to be a part of? You know, that might be the type of conversation that you could have with faculty that could actually come in handy. Okay, so we have a much more detailed admissions page with all of the application instructions that I highly recommend. Of all the pages for you to bookmark that page, and it will be linked in that email I send out later. But just going through the checklist of what's in the application, you will apply online through the University of Washington Graduate School's online application portal. And there is a $90 fee to apply to the program. Or there are waivers available through the grad school. If you do request a waiver, though, make sure you do it at least a week before the deadline. Because a human has to go in and see that request and pay the application fee. So you want to give them time. And again, this is part of the reason why I said get that application in early, because as you might imagine, those pile up in December when a lot of folks who've been, you know, tweaking and perfecting their applications finally hit submit and put in those requests. So another reason to get it in early. Next, you'll provide unofficial transcripts from every college or university where you've earned a degree or taken relevant coursework. So this will be a PDF upload. So you might have a hard copy in your hand. If you do, then you can scan that and send it to us, or you might have a PDF online that you accessed through your university. Yeah, unofficial means that you have access to it and that you are the one sending it to us. And that must be done online. We don't accept hard copy. You can't like mail in your transcript to us. If you receive an offer and you accept your offer, then you will receive instructions on how to get us official transcripts, but you don't have to worry about that at this point. Next, we have 3 letters of recommendation. These very commonly come from academic sources like a professor, mentor, or research PI. And they can also come from other sources like a current or recent supervisor. A note about this, a lot of folks, sometimes they feel shy reaching out to faculty members or mentors or supervisors because maybe it's been a few years. My advice would be advocate for yourself. You deserve this. Also, I would say in that email where you're making that request, it's a very nice gesture to remind them of the work that you did together or of a project that was valuable to you or something about, you know, help them remember you if it's been a while. Yeah, and the worst that they can say is nothing or no. So yeah, like I said, advocate for yourself. You know, it's part of their job. They expect to receive those requests. Next, we have the resume or CV. Make sure that's updated. And then if English is not your first language, you might have to submit scores to us. Please review the English language proficiency requirements. Sometimes people will send me questions with their specific situation, asking me if they have to send in those scores. And I will always send you to this page because there might be something on the page that you have not reviewed. And I don't want to ever tell you like, oh yeah, don't worry about it. And then have it be too late for you to get those scores. So please review this policy if English is not your first language. And then next we have our essays. So again, these might be minorly tweaked before September. So this is another part of the reason why I want you to bookmark that admissions page. Any tweaks that happen, you'll see within the next month or so, though. We have the statement of purpose, which is a professional background, career goals, and the educational objectives that you expect to meet through this program. So again, I mentioned that this is where you can tell us why this program, what is this going to do for your career? How did your background prepare you for this program? Also, let us know which areas of emphasis you feel the most drawn to. This is the big one. I know that sometimes having two statements can confuse people, but no, this is the one that's really about this program, would be the statement of purpose. This is also where you can list those faculty that you're interested in working with, or which research centers in our department you feel drawn to. And then next we have the personal statement, or personal history statement, it's also known as. So this is where you share personal history, family background, influences on your intellectual development that reflect your commitment to equity, diversity, and inclusion. This statement may include social, cultural, economic, and educational opportunities or disadvantages that you've overcome and the ways in which these experiences have affected you. And then GRE scores are not required. We stopped requiring those in the height of the pandemic for a bunch of reasons, and then we just never went back to requiring them. That being said, if you did take the GRE and you have a great score and you want to share it with us, you have the option on the application to share your score, but just know it's not expected. You do not have to, and you will not be dinged for any reason if you do not share it. Most people these days are not, but we want to leave the option open if you did go through the process of taking the GRE. And again, much more detailed application instructions on that admissions page. Okay, so at this point, I'm going to wrap up, pull it all together, and then move into Q&A. So why pursue your doctoral studies with us? Why the University of Washington Health Services PhD program? We are training the next generation of health services researchers. We've been doing it for more than 20 years. I think we have a great model here. We have personal attention through excellent mentoring and flexible courses of study, rigorous and comprehensive curriculum, strong relationships with local research centers and medical institutions. We're committed to providing financial support in the form of traineeships and research assistantships. We have an exceptional record of student publication, fairly quick average time to degree at 4.5 years, strong record of alumni career placement, and we're part of the top-ranked UW School of Public Health, recently ranked 7th in the nation, according to US News and World Report. And we're in beautiful Seattle. If you're from here, then you might already know this. If you're not, you should come visit. But Seattle is awesome. I moved here in 2020 from Boston. I'm originally from Ohio, and I don't want to move anymore. I love the Pacific Northwest. I love Seattle. Here on the left, we have Rainier Vista, where we can see Mount Rainier from campus when the mountain is out. On the right, we have the Puget Sound with the Olympic Mountains in the background and our famous ferries. On the bottom, we have a picture of campus with our famous cherry blossoms blooming. It's a great place to be. We don't have the capacity to provide tours in this department or directly from the School of Public Health. So what you would do is go through UW campus tours, which I have linked at the bottom. And they also have a virtual tour if you just want to do it from your, bed or whatever. You can do it virtually. But yeah, I love Seattle. Look at how happy I am here. This could be you kayaking on the Puget Sound. All right, yeah. So before I segue into Q&A, if anybody does have to hop off, I just want to make sure that you see my email. It's hservask@uw.edu. So if you have to jump off, please feel free to send me your questions, or you can book Zoom advising. It's also in the link in my signature, which you'll get later. But yeah, any questions that anybody has, please feel free to type those into the chats. I'm also happy to go back to any slides. If it's not a me thing, I can do my due diligence to try my best to find the link to get you the info. Yeah, how many do we admit each year? So this year it was I want to say 4. It could range from anywhere from 4 to 8. In recent years, though, it has been closer to 4 or 5. This program is not considered to be an official STEM program. And then this one is the average number of applicants the program receives each year. Anywhere from like, it ranges. Some years are like 55. One year was 103. I'd say the average would be probably in the 60s. Next question, do we have an age limit for applicants? Of course, no. As long as you have a bachelor's degree from an accredited college or university, no age limit. Can a student who has done an MBA in healthcare apply for PhD? Yes, certainly. And like I said, if you're, let us know in your written materials how your education, how your past progression has prepared you for this program. Do I have to do my research project in the US? So, like I said before, most students do research here on US healthcare matters because that's what our faculty are mostly experts in. That's where we can give you the most support. That being said, there have been some students who, after they complete their coursework in the US, you know, and you're done totally with your coursework, you don't have to be here to do your research. I think we have at least one person right now who is doing their research abroad, maybe two. So it's not unheard of. And some folks do eventually specialize in healthcare matters outside of the US, but again, we're more set up to support you in United States healthcare matters research. If one wanted to do implementation science, would this program or global health be a better fit? Well, I can't speak for the global health program. I encourage you to also attend any of their info sessions and do research on them. But we have an implementation science area of emphasis. So I think we would likely be a good fit. I can't say how we compete with global health, if that makes sense. But definitely encourage you to look into our implementation science area of emphasis and the courses that we offer, and maybe talk to our area of emphasis lead. And yeah, see how this program would help you meet your goals. Okay, so it looks like we're about to be at time and some folks are dropping off. So before everybody leaves, I do want to say thank you so much for joining me today, for you know, taking the time to learn about this program. Hopefully we sound like the right program for you. But what's important to me is that this info session was helpful and that it helped you decide if this is going to be the best way to meet your career goals. And I also want to encourage you to check out our website. We share different stories like blog posts, news stories about the research that our students, alumni, and faculty are doing in the real world in public health and their accomplishments. And I think that that's a great way to learn about the program and find more inspiration and find your fit in the program and imagine yourself here. It's another way on top of conferences that we can offer to give our students recognition, is writing those news stories about them. And we share them on our social media on LinkedIn and Instagram and Facebook and Twitter. And yeah, so check those out, find more inspiration. Instagram and TikTok, our handle is hspop_UW.